Oops. You're ahead of the game there, Kathy. That's good. Okay, good afternoon, everyone, and thank you for being here. Got a lot to go over today, but it's all important. And I want to begin by talking about Rhode Island's American Rescue Plan funds and why it's time to make a down payment on Rhode Island's economic comeback. Rhode Island has a reputation of being the first in and last out of economic downturns when it comes to recovering from an economic crisis. That reputation has been earned during the past recessions. However, our previous reputation does not match today's reality. With one of the highest vaccination rates in the nation, Rhode Island is already emerging from the global pandemic with strength. Our state reported a 7.2% increase in real GDP in the first quarter of 2021, exceeding the growth rates of the United States and the New England region. Rhode Island has also ranked among the top 10 states nationally and led the Northeast and Moody's Back to Normal Economic Recovery Index for the last several months. As of today, Rhode Island ranked 4th in the nation and number 1 in the region. Let me say that again. As of today, Rhode Island ranked 4th best state in the country and number 1 in our region for economic reopening. While Rhode Island is leading our economic reopening, we shouldn't take our foot off the pedal and allow other states to catch up with us. Rhode Island is the only state in the Northeast that has not spent $1 of our American Rescue Plan State Fiscal Recovery Fund, the $1.1 billion from the Biden administration. And I believe if we invest soon and invest wisely, we can continue to lead rather than follow, creating opportunities for Rhode Islanders as a result. It is time to take at least 10% of these federal funds and make a down payment on Rhode Island's economic comeback. Let me share with you a few examples of some immediate investments that I believe as a state we should be making in the near term to bolster the economic recovery. Rhode Island's small businesses have been hit hard by the COVID-19 pandemic. And while both federal and state government has provided a range of small business resources and supports, there are clear gaps, especially as emerging variants pose potential risks to consumer confidence and the small business community. Additionally, certain industries, such as tourism, travel, and events, have been hit particularly hard and face major challenges and long-term shifts to consider business demand in response to trends due to COVID-19. I believe our small business cannot wait for assistance. I'm proposing that we make significant investments in financial and technical assistance to small business, including public health adaptation supports, similar to the popular Take It Outside program, and ventilation supports, wraparound business supports, e-commerce and other tech upgrades, Main Street storefront facade and streetscape improvements, and workforce recruitment and training. We should also use a dedicated portion of these funds immediately to offer support, including capacity building, contract procurement assistance, accounting and financial assistance to our minority-owned and woman-owned businesses. It is not acceptable that Rhode Island has not hit the 10% requirement for MBE and WBE procurement. And it is on us as a state government to assist our minority-owned businesses to be able to compete for procurement opportunities in the state, especially at this challenging moment in time. We all agree that we have a housing crisis in Rhode Island, and this past legislative session, we as a state took action to begin to address it. We now have a permanent dedicated funding stream for the creation of affordable housing, and we've created a new position in state government to specifically oversee housing initiatives. While this is a good start, we must do more. Rhode Island can unlock substantial federal funds to create affordable housing units. Let's immediately invest American Rescue Plan funds to support the creation of hundreds of units of affordable housing. And additionally, let's invest funds to acquire properties to support housing development. The winter is coming, and we still have 336 individuals living on the street, and we need to get those funds out to make sure that we protect them before the cold weather arrives. We should also use funds to provide down payment assistance for disadvantaged households, target blighted properties and communities heavily impacted by COVID-19, and finally, have a real plan to provide affordable broadband internet for every Rhode Island family. Workers cannot return to work if there's not a safe, quality, affordable child care for our kids. However, the child care industry has been hit hard by the pandemic and now is struggling to attract and retain workers due to low wages in the industry driven by lack of public investment. Let's start by investing some of these dollars to incentivize and promote the retention of experienced workforce across the system and to support more family child care providers to open. Specifically, let's provide premium pay retention bonuses to supplement baseline wages for over 8,500 workers who are primarily women and women of color and cover many of the startup costs for new family child care providers. These are just a few of some of the ideas that my administration has developed for immediate investment. We also need to invest in long-term and utilize these crucial federal dollars to propel Rhode Island into the next decade with strength. We believe the balance of the funds, 90%, can and should be used for longer-term investments. The two types of investments that can complement each other. My administration has been holding a series of community conversations in which Rhode Island community leaders, stakeholders, and advocates have laid out what they think we should do to ensure immediate recovery and long-term growth. In addition to housing, small business, and child care, we've discussed the need to invest to address infrastructure, climate change, public health, education, and much more. I'm excited for the future of the state of Rhode Island, but conquering the challenges and capitalizing on the opportunities ahead will take all of us working together to ensure a more resilient, equitable, and prosperous state for us all. Next, I'm glad to announce today that applications for the third round of the Vaccinate the Ocean State mini grants are now opening through the Department of Health. This program was previously known as Crush COVID mini grants. These grants are available to nonprofit community organizations to promote and support COVID-19 vaccination efforts. The grant program is funded by the CDC Health Disparities Grant. We're glad to be able to administer the program here in Rhode Island to support our COVID response. These mini grants range from $2,000 to $49.75. We have $223,000 available for this round. Preference will be given to applicants that serve communities harder hit by COVID-19 and communities with lower COVID-19 vaccination rates. The deadline to apply is Friday, September 30th at 5 p.m. There will be a virtual information session on Friday, September 24th from 11 a.m. to 12 p.m. to answer the questions. We'll be sharing that info later this afternoon. Information is available on the Department of Health's website as well as my social media web pages. We're asking Rhode Islanders to help us spread the word, and we thank you all, the nonprofits who have stepped up to support Rhode Island's COVID-19 vaccination. I attended the Operation Stand Down this weekend in Johnston, and multiple of the nonprofits that were there have already been helped through the initial $10,000 grants that we got out to 75 small nonprofits, and it's time to continue that effort. We couldn't have reached 86.7% of adults with at least one shot without these organizations. And finally, I want to take a moment to talk about an update on the Overdose Prevention and Intervention Task Force. A couple of weeks ago at this press conference, it was brought to my attention that community members and providers had concerns about the federal allocation of Rhode Island State Opioid Response Grant coming to an end and its impact on funding going forward. This is a crucially important issue that has only been intensified by the pandemic. After hearing these concerns about the end of the federal funding, I asked our team to review options and come up with an interim funding solution and a new inclusive communication process going forward. I'm happy to be able to share that the Department of Behavioral Health Care, Development, Disabilities, and Hospitals has reallocated dollars from new projects and worked with our state partners to find the funding necessary to meet the requests of the community members and providers. Pending authorization from the Substance Abuse Mental Health Service Administration and the Department of Administration, BHDDH will continue each of the reduced contracts attached with level funding according until October 1st, 2022. This will provide additional time to discuss funding solutions going forward. I want to again thank those community members and providers for their participation in our Governor's Overdose Task Force and their commitment to tackling Rhode Island's overdose epidemic. And I really want to stress the point that my door is always open to members of this task force. As governor, I want to be working together as partners to ensure that we're doing all we can to address this epidemic and support those impacted. And I'd like to hand it over to our Lieutenant Governor, Sabina Matos.
Thank you, Governor. Good afternoon. Thank you, Governor, for your bold leadership in putting forward this plan for preliminary investment to build Rhode Island back better. I have visited cities and towns, and I have been speaking with the residents of the cities and towns, business leaders, and also elected officials. In the concerns that you outlined here, the concern is exactly what you outlined in this plan here. We have to invest in the workers and workforce development. We have to invest in affordable housing and workforce housing, and we have to do it now. We have to make affordable child care a priority. Just this morning, I was participating of a conversation with the Newport Chamber of Commerce in which the topic of the child care came up as an issue for workers to get back to work. So this is an area that we need to make sure that we are prioritizing. Also, as the indicators have shown, that the women has been the slowest one to get back into the workforce due to the child care issues. So this is an area of high priority. Many of these families have to choose between a paycheck of caring for their children, and that shouldn't be the case. We also have to make investment on the hardworking families, and we also have to invest in our state climate resilience to secure our Rhode Island for generations to come. We also have this once in a lifetime opportunity to make a real investment in our state future. So, Governor, I'm in complete agreement with you, and it is the time to act is right now. I look forward to working with you and my colleagues in the General Assembly to ensure and make sure that Rhode Island is coming back in an equitable way. And also, I'm glad that you included in your presentation the importance to address the MBE and the 10% law to make it a reality. So thank you for your leadership in these areas. In other areas that I would like to mention to all the community that is watching right now is that this weekend we're going to have a vaccination clinic going on. Actually, it's a vaccination event that's going to take place at PCTA. This is in combination with RIDE, the Commissioner of Education, Helica Infante-Green, and the Governor's Office, Governor McKee also will be there. We want to make sure that everyone who qualifies to get the vaccine is able to get it, and we're going to have a vaccination celebration, and we're going to have giveaways. So make sure to come out for this event. With that, I'm going to turn it back to the Governor for questions.
Thank you.
All right. We'll start over with Brian.
Governor, what do you see as the approval process for this money? Is it going to have to go through the General Assembly, or is it just through you?
No, I think that, as I committed before, it's going to be a collaborative effort with the General Assembly. So I had conversations with the Speaker and the Senate President this morning about the comments that I was going to make today, and we'll be following up with a meeting to continue the process. I just want to make it very clear that the time is now to get some of these dollars out. We don't want to be chasing the economic recovery. We want to be leading it.
So how fast do you expect it to be that some of this money is out the door in people's hands?
Well, I think we need to make sure that we get the money out before the end of this year, and then we can identify the places where it is in most need, and then we can also start planning in the next session longer term, and then also some other short term needs that state of Rhode Island could benefit from.
Governor, do you have a plan in each of those areas you just outlined that's ready to go? If the Speaker and the Senate President said, we're ready to do this, do you know how much you would spend in each of those areas and how you would spend it? And if so, how much?
Well, we've got a concept on that, and the Commerce Secretary is here to answer questions after the fact, after the press conference that me talking. But I think the whole idea is to identify areas that really need the help in those places, which is the economic recovery. We know that Providence has been very hard hit. We know that hospitality has been hard hit, as well as some of the travel and tourism issues, along with many of the small business in particular. And in the other areas we talked about, childcare. Clearly, I mean, before I came here today, I got a note from one of our nonprofits pointing out one of the parents that had their child with them at work at the nonprofit because they couldn't afford to send their kid to childcare, their daughter to childcare. So this is something that clearly is something there, and I did highlight the fact that if we had funds right now, we should have been working a few months earlier on the issues of the homeless, and then other housing issues. We can create long-term strategy, but right now the priority that I see is the 336 people that are living on the street and the 200 people that are in our hotels and another 700 people that are in our shelters.
And when you spoke to the Speaker and Senate President this morning, told them what you were going to say, what was their response?
Well, I think they recognize that good use of these funds is going to help the state of Rhode Island. It's just a matter of how we're going to get there in terms of whether they reconvene or what method they might use. I know that there's a hearing this afternoon with the Senate on the Finance Committee to discuss this, and I believe that there's another meeting today on the House side to start organizing a strategy here. So I think that shows that there's a real interest in trying to get a jump start on these funds, as I described in my comments.
Governor, there's been a big focus on vaccinations for frontline workers, police and fire. There was a story in the Providence Journal that the state's not tracking vaccinations for, I believe, state police and sheriffs. What can you tell us about that? Was it your decision that we're not tracking state police who were around you that are not being vaccinated?
No, I think they should be. I think that is an area that we should make sure that we do track.
Have you discussed with Colonel Manny, who made the decision that they're not being tracked, or were you surprised to learn that?
Yeah, I would have expected that we would have known that.
And one just other quick question. Since June, I believe, Bud Craddock, your head of the DMV, has been under investigation, landlord, renting for these type of massage parlors. What is the status of that, and do you have a timeline on when? It seems pretty straightforward, but when that would wrap up?
So I haven't seen the final report from the state police, review or investigation, and that's all I can really comment on that. I haven't seen it, so I don't know the timeline.
Come over here.
Governor, on October 1st, your vaccine mandate goes into effect, and we've heard concerns from healthcare facilities that they're going to lose at least some amount of staff who are refusing to be vaccinated. Is there a contingency plan in place on October 1st? Are you thinking about bringing the National Guard in potentially to help if on October 1st there's a staffing crisis at hospitals, nursing homes, and various other institutions? So
we've been in constant contact with the hospital leadership, and they are really encouraging us to hold the line as we are on the October 1st date. So we will, and they've shared with us that they have plans to do the staffing or to manage the hospitals. One of the things that I would point out right now on the Delta is that we have one of the lowest hospitalization rates in the country, right? So I think that that's really helping them a great deal. In the two areas that we managed, with both Elena Slater and our vets home, we're looking at just under 60 people that we are anticipated are unvaccinated at the moment, and we have a contingency plan to fill those places. In fact, the people don't get vaccinated.
60 out of how many people, and has the National Guard come up as an option?
So I'm going to be guessing here, but I think it's like 400 people at the vets home, and I think it's somewhere around the same, about maybe 400. No, I'm not sure what it is at Ellis later. It could be several hundred.
But that 60 is a total number?
Total, yes.
All right, Bill?
Governor, what about using funds for replenishing Rhode Island's unemployment fund, or any other ideas maybe that have come up that you've kind of assessed and said it's not the appropriate decision? Anything you've heard from the community that's been kind of voiced and you've said, you know what, this isn't the moment for use of the funds?
I think it's an appropriate use. It's in many of the decks that I'm seeing in terms of the strategy, which we have submitted to the Treasury, a placeholder on those funds as the deadline was like August 30th. We're supposed to have another update with them within 60 days. So I'm looking at those updates, and restoring that unemployment fund makes sense in many ways. And so that's certainly a strong consideration.
Okay, come over here.
Governor, question on the vaccine front. FDA a couple weeks away from approving the shot for children, young children. Just looking to get your reaction to that. And have you thought of how that rollout process could look here in the state to get as many kids vaccinated as possible?
Yeah, so the students are, a really strong focus for us. I've mentioned a couple times the leadership that the universities have given on their students. 95% of those are vaccinated. There's well over 100,000 students there. We are putting a strong focus into the high school students and the middle school students that are eligible at 12 and older right now. I'm told that a little over 50% of them have been vaccinated. We want to get that up to the 90% level as well. And then the 5 to 11, which is in your kind of your elementary schools, K through 5, we're prepared for that. Once that comes our way, we'll be prepared. I think that one of the things that we've been really strong on is the partnerships with our municipalities and then being able to be local with those vaccinations. And the Department of Health is preparing with RIDE at the moment with our staff to make sure that we're as efficient as we have been in the overall vaccination strategy.
Could we see vaccine clinics like in elementary schools, kind of similar to what we had before?
I think that a great deal is going to go through the pediatricians as well as through the school nurses. And then where we need to set up local, clinics, we will do that where it's needed. But that's a high focus on us. So right now, especially on the high school students, we really want to see that percentage increase, and we're putting a great deal of effort into that right now, and we'll do the same thing on the lower grades.
Brittany?
Thank you. Two quick questions. First one, you said 90% of the American Rescue Plan funding is going to be going towards longer-term goals. Any general idea of what those goals could be?
Well, I think that it's a broad base of ideas, right? And I think that they're very central ideas that most people agree on. Economic issues, for sure. Child care issues, I think that that's a real important issue, as well as housing. They seem to be predominant. Family type of services are right along there with it, and also the mental health issues that are related to COVID in general, right? Because of the pandemic, where the behavioral health issues, mental health issues are central as well. So those are just kind of a few of them. But I think in the long-term economic, I think that the discussion certainly has been about on the green and the blue economy being important. We are actually applying for additional funds with the Secretary of Commerce, Raimondo, gave us an overview of some funds that are going to become available in that space. Applications are going to be due by mid-October. So the opportunity is really, really great. And I think that the ability for us to address some long-term standing issues that are impacting, different communities of color, and equity issues would be front and center as well.
Governor, one from Target 12 for you. So you were on a Zoom meeting in which a managing partner of ILO Group was invited. She didn't show, but on the Zoom was McKee, the state purchasing agent, your then chief of staff, and the director of the Department of Administration. Did you discuss the RFP that eventually led to the ILO contract, and what did you talk about?
So a few days before being sworn in, I went to the biggest experts I could find on the transition. We got to remember where we were back in March. We were in a crisis, right? A crisis on health, crisis on economics, and a crisis on education to get everybody back in the classroom. So that was one of the meetings that we took, and we discussed issues about how to safely open schools. And Dr. McKee is a national expert on that. So we relied on our experts to determine how can we safely get students back into schools, and also the vaccination strategies that we're not, we had a long way to go on our vaccinations, and we provided every possible opportunity to learn more about how to get it done. And I think that we've done a great job there, going from the worst vaccinated state to one of the top vaccinated states in a very short period of time.
A couple of follow-ups to earlier questions. When you were asked about the healthcare workers in the state facilities, and you said about 60 appear to be unvaccinated, and you have a backup plan. What is your backup plan, and what categories? Are these nurses? What kind of jobs do these people occupy, and who do you bring in to take their jobs?
So they're a combination of nurses and also the CNAs. So the backup plan will be to, as we have in the past, bring in resources that can bring in additional personnel. But we're still very hopeful that we're going to be able to work. It's a small number. When we talked about it a few weeks back, there was about 200. So we're making a great deal of progress in that area. But we cannot have our hospitals and our vets' home are not covered with personnel. So the backup plan is multiple issues where we can potentially use retired personnel as well as people who are kind of traveling type of personnel in the healthcare industry.
Aren't you going to be competing? Well, and then one other question, but aren't you going to be competing with every other hospital that may also have an issue of after October 1, certain people can't come to work? Do you already have contracts or commitments from the staffing agencies?
As of yesterday, I believe that we will be entering into an agreement on the staffing from the staffing agency, yes. I don't know whether that's been signed or not yet, Kathy. But I don't know.
And one last question having to do with the sheriffs and the state police. Just so I understand your answer, are you saying you think that both the Department of Public Safety should track their status, or are you saying they should be vaccinated? If it's just track their status, then what if they find out one of their members is not vaccinated? What happens then?
Yeah, so we're going to continue to be in that framework where we're going to be highly recommending vaccinations to all the staff right now, whether it's state police or whether it's in the state departments. We still have not come to an agreement with the union, as we discussed over several weeks ago, which we've been in conversations about the vaccination. But I think that we should be tracking everybody that works for the state, and we should know what those percentages are. Just like I just told you what our percentages are on our student base, right? Population. We know what the teachers' vaccination rates are. We know that if we get to a high percentage of vaccinated across the board in the population in the state of Rhode Island, and that's what's happening right now, we're pushing back on the Delta. The Delta is not winning in Rhode Island, and there's a reason for that. It's the vaccination. So we're not going to relax until we see 90% of the population that is eligible for vaccine to be vaccinated in the state of Rhode Island.
Okay, we're going to go to Michael, Pat, and Steve.
Governor, you may want to pass this question to Lieutenant Governor Mattos
or
Secretary Pryor, because I know they've been heavily involved. What is the status of Rhode Island rent relief through Rhode Island Housing? How much of the money that's been allocated has been spent? How much money has been allocated? And what is the average time between application and completion? What is the rate of approval? What is the rate of objection? And what resources can you provide for people who are having difficulty navigating the rent relief project?
I'll start. During the Equity Council, we invited Rhode Island Housing to come. At that time, at that meeting, I believe it was last week, the week before, they were at 20 million already has been allocated of the resources of the 200. They are making progress. There was a new flexibility that came from Treasury that allowed them to make some changes on the qualifications. They're making a lot of progress. In the conversation that we had with the representatives from Rhode Island Housing, something that was brought up during the conversation is that maybe based on the requirements that Treasury has for the money, there's a possibility that we may not be able to use all that funding, which is an area that I hope that's not the case. We're trying to look for any possible way in which we can make sure that we can commit those funding so those fundings stay in Rhode Island.
Yeah, and I can give a couple updates. I think we're a little over $25 million that has been allocated at a fairly rapid pace right now. And as the Lieutenant Governor said, we've been talking to Treasury and the White House about the complications of the application process. That's been streamlined significantly, a little slower than I had liked, but certainly one that I'm satisfied with. I believe that we're going to be doing a batch of utility payments in the next few days. That's going to be in that $16 million to $20 million range for people who are, behind on their utility payments. So, in all, I certainly was not very excited about the rollout in terms of the pace that it was going out. But I think that today we are doing as well or better than any other state that I'm in New England, although we did lag behind. And I believe in the pipeline right now, the last numbers I saw was about $25 million that has been approved that we're very hopeful is going to get released by the end of the month. That's what I've asked them to do. And then I believe that they're on a 10-day turnaround in terms of the applications that qualify. So we're making significant progress, and I think that we will have, and I got a text this morning from our staff in terms of the Treasury. We're not looking to give up any of those dollars, and I think that we're in a position where I think we can protect all the dollars that were provided and get those into the right families' hands that need the help.
Do you have a sense yet of how many people are still stuck in the pipeline? How many applications remain pending without final resolution?
I'll be guessing. There's several thousand that are in that range of that 25 million that I'm anticipating are going to get those dollars in short order. And then what I've been told is that applications that are coming in that are qualifiable will be on a 10-day turnaround right now. So a significant amount of progress. Thank you to the Rhode Island Housing and everybody that has been working there. And I would just say to the people who are listening, if you're in a spot where you're having trouble paying your rent, you need to call our office or call Rhode Island Housing. Even if you had maybe had contacted us a few months ago when things were going a lot slower, I think that we're in a position where I'm fully expecting that a great deal more money will go out before the end of September and then into the fall. Yes.
Governor, before I ask my question, if I can amplify a point by Ms. Gregg. To be blunt, right now, we're past, by the way, the 2-week window, if you will, for the dual vaccination. The state of Rhode Island is essentially putting into motion a plan that could result in the firing of nurses, yet for the same condition, policemen won't be fired. Is that true?
No, so I think that, again, I think Dr. Scott, and we'll certainly get back to her before October 1st so she can explain what we're working on at the moment. We're going to take every measure possible to make sure that no one loses their job, but at the same point in time, we're not going to relent on the fact that healthcare workers keep people healthy and to be healthy, and they got to be healthy themselves to keep people healthy. So there's a distinction between what a healthcare worker does and even what a police officer does. Both have important jobs, but we're focused on the health idea here, which is in our congregate care settings, in our hospitals, they were at most risk. Now we're doing great on the vaccines, but we don't know what's coming down the line. This uncertainty has been there since I took office in March, and it continues today.
But both sets are first responders, and I do have a question for you, but there's a question of fundamental fairness there, isn't there? I mean, police in this state are above, if you will, the type of conditions as first responders that emergency care workers are, EMS drivers, EMS, all of those folks. There is a dual standard here. Is that correct?
Yeah, there's a difference in what they do, so if that creates a dual standard, then that's correct. I mean, the hospital workers, healthcare workers do different work than our public safety in terms of the police.
They both respond to accidents. They both respond to primary. I don't want to belabor that point, but will police who are not unvaccinated, will police who are unvaccinated be able to retain their employment after October 1st?
Yes.
Okay. By the way, this is the type of issue that's coming up again.
Your next question.
Okay. That was about to.
Yes. Well, you're onto
I'm
the phone now rather than
getting
computer. You're making
conversations
progress.
directly
That's
with
good.
people who, for example, one RN, registered nurse, who just finished nursing school a couple years ago. She's got something called unresolved pericarditis, which is listed on the exemption form. Previously, her doctor had suggested that she not get the vaccination. Now that doctor is unwilling to sign off on the form and is requesting that she seek additional treatment or additional analysis, which of course will take weeks. Is the Department of Health pressuring individual doctors, as is being anecdotally reported, to deny these type of, quite frankly, straightforward medical exemptions?
That's not my understanding, so I would say no.
All right. Steve, last question.
Governor, two parts, if I might. With regard to planning for after October 1st, in the eventuality you have what's been described as a potential crisis, are you ruling out opening the field hospitals or calling up the National Guard?
So in the field hospital, we're very happy to say that we're not reopening a field hospital because there's not a need for that in terms of the COVID, which is a blessing, right? I mean, we were prepared if we needed that. And if we need to call in the National Guard, they stand ready. I mean, we are so fortunate to have a National Guard that is able to do that. At the moment, we don't see that as an option, but clearly if we need them, they will respond as they have throughout the pandemic.
And you said that here today that it's been some weeks that you've been in negotiations with state employee unions about vaccinations and so forth. Respectfully, Governor, it's been months that we've been talking about this here. What's the holdup?
Well, negotiations can take time, and we're going through the process right now with them. And also, we are in a very good spot right now relative to vaccinations, relative to public safety, the safety of the people who live in the state of Rhode Island. We'll work through those negotiations, which is complicated because we're in a contract negotiation with them as well. So it's not just the negotiations on the vaccination, it's also negotiations on a long-term contract.
Is it not a priority whether state employees are vaccinated?
It's a priority. I mean, but we've established where we believe the highest priority is, which in the healthcare workers, and which many of the state workers are healthcare workers.
All right. Thank you all.
Yeah, thanks.